everyone, this is Dr. Nasser, and in this clip I would like to tell you about a collective group of diseases that are referred to as plasma cell neoplasm. In this group you have plasma cell leukemia as well as multiple myeloma, among others. The actual subtyping requires further investigation, bone marrow biopsy and aspiration, flow cytometry studies to identify the antigenic profile on the surface of the cells, and then one would be able to determine the exact subtype. But at the first line of identification is the blood hematology, if the patient already not showing symptoms that allows the diagnosis. And in here, at low magnification, you can see perhaps there is slight ROLU present. I would say perhaps 1+, and the number of white blood cells appear to be normal. This range probably is going to be normal range. When we go to higher power, we note that there may be perhaps some anemia, slight amount of anemia. There are some artifacts in here. This is an artifact. There are red blood cell inclusions. I do believe that red blood cell inclusion is also an artifact, and every one of these red blood cell inclusions are artifacts. These are all artifacts. This is a platelet on a red blood cell, and another platelet in here, and perhaps this is a platelet. But the rest of the inclusions that you see appear to be artifacts. Be aware of that. The lymphocyte looks like a resting lymphocyte. The chromatin pattern is lymphocytic. The cytoplasm doesn't have much granulation or color, it's scant. And if you look at other cells in here, you do see a segmented neutrophil, appear to be normal looking, not much of toxic granulation present, and appears to be just fine. A normal looking neutrophil. This corner of the cell is slightly basophilic, and I'm not sure whether or not this is Dolly body, but I do not think that's a Dolly body, no. So, normal looking neutrophil. We continue our search for other cells, and as we go through the field, we come across different cells, and until we come across a cell like this. This is a plasma cell, and its characteristic is diffuse chromatin pattern, oval or round nucleus, large amount of cytoplasm. This cytoplasm, in cases of multiple myeloma, can be very basophilic, and that would be a very distinct type of cell that you can see in specific disease. However, the general features of a plasma cell is this nucleus with diffuse pattern pushed to one side of the cytoplasm. There's a large amount of cytoplasm, and there is no other cell that appears like a plasma cell anywhere. So on this report, I would certainly make a note of the presence of ROLU as well as the presence of plasma cells.